So, Kristin, you're live to go anytime.
All right, so hello everyone. We're just going to give everyone a few minutes to get into the session, so we will start momentarily, but thank you for joining. Okay, so we'll start. So welcome everyone to the sports performance session. Today you're in for a real treat. We have 12 great presentations. My name is Kristin Morgan from the University of Connecticut. My co-moderator is Dr. Jill McNitt-Gray from the University of Southern California. Also our student moderator is Anahita from the University of Wisconsin-Milwaukee. So just a reminder for everyone to make sure that you continue to stay muted so we are not a distraction to any of the speakers. This session will run as follows. We'll first have the 4 speakers give their 5-minute presentations, followed by a 10-minute question and answer period. Amongst that 10, if you have a question for the speakers, please do so by sending it to the Zoom chat. And if you really want to make sure that you direct it to the right person, please put @ and then their name, so we make sure that the right person gets your question. So now we will get started to allow time for all the speakers. Our first speaker is Glenn Fleisig from American Sports Institute, Medicine Institute, and their talk is on should baseball adjust the mound height and pitching distance.
Hi, everybody. Should baseball adjust the mound height and pitching distance? This is a question both in youth baseball and in adult baseball. And in fact, we did a series of 3 studies sponsored by Major League Baseball. The first one looked at mound height and pitching distance in youth baseball, and then the other 2 looked at separately mound height and pitching distance, but with adult pitchers. Yeah. Now in youth baseball, well, in adult baseball, the mound is 10 inches high off the ground. And in youth baseball, some youth play with mound 10 inches off the ground, some have flat ground, and there's everything in between. The question that many people have raised is whether pitching from lower mounds is more natural and less stressful than the higher 10-inch mound. As far as pitching distance goes, youth pitchers throw 46 feet to home plate, adults throw 60.5 feet to home plate, and then some leagues, some towns have an intermediate distance of 54 feet. Now, the question is, as the kids progress and move to the farther and farther distances, do their mechanics change and does stress increase with the farther pitching distance? So we did a study where we looked at 20 healthy pitchers who were 12 and 13 years old, because that's the age where you start to essentially change leagues. And as far as mound height goes, we had each of the kids throw from 10-inch high mound, as you see on the far left, or 6-inch high mound, or from flat ground. You can see that there's a pitching rubber thrown on the ground. And for those, we had them throw the intermediate distance of 54 feet. For the other part of the experiment, we had them throw either 46, 54, or 60.5 feet from the standard adult 10-inch mound. And we did that by varying and moving. In the picture on the right, we moved the home plate farther or closer so we could keep our motion capture system in the same place and vary the distance that way. We had each subject through 5 pitches from each of those conditions, and we had a radar gun that tracked the ball velocity and a full motion capture system, Motion Analysis Corporation, to track the biomechanics of the pitchers. And the order was randomized of the trials per subject. The results were there was no difference in ball velocity for the different height mounds. There were several kinematic differences, such as like the knee flexion or the trunk tilt from different height mounds. But as far as the kinetics go, there were no difference in elbow and shoulder forces and torques with mound height. As far as the pitching distance goes, there was no difference in their pitch ball velocity for the different distances. However, there were several differences in kinematics. I think they were trying harder to throw the farther distance. And resultingly, as pitching distance increased, the shoulder forces and torques increased. As far as the adults go, why did why is adult baseball, Major League Baseball specifically, considering lowering the mound or changing the pitching distance? Well, what they're trying to do is add more offense into the baseball game, make it more exciting that way, but they want to do that without increasing the risk of injury. So which of these ways can they increase offense but not increase the stress on the pitcher? Can they lower the mound or increase the pitching distance? Well, for lowering the mound, we did a very elaborate study, ASMI, with Major League Baseball and USA Baseball and Modus. Did a study which we published last year. Here you see the team working, and we went to North Carolina and built this tent behind the stadium, behind the field, and we installed 4 mounds, which were all built by Major League Baseball at 6, 8, 10, and 12 inches of height, and 2 motion capture systems around each pair. And you can see here the 2 motion capture setups with each pair of mounds. And again, the mounds were 4 different heights. And then we tracked the ball with a Rapsodo system, so we could either through the catcher or to a strike zone, and we tracked the ball velocity as well as the ball movement. And again, as I said, there were 4 different mound heights, 6, 8, 10, and 12 inches. And there were 2 pitch types. All the pitchers threw fastballs and curveballs from each mound. And we used 20 adult collegiate pitchers, healthy pitchers. The results of this study were there was no change in ball velocity or ball break. And there was a small but statistically significant change in the kinematics. And we saw as the mound height got lower, the lower mound heights actually had less kinetics, lower kinetics when they threw the fastball. As far as pitching distance go, we did another study more recently where we had 26 pitchers come into our lab in Birmingham, and we used Motion Capture System, Motion Analysis Corporation again. We used PitchFX to track the ball velocity and motion. We had them throw 60 feet 6 inches to a catcher, and then the catcher moved back to 62.5 feet or 63 feet 8 inches, and we tracked the motion analysis data. The results were there was no difference in ball velocity for any of the pitching distances, but the time from the pitcher to home plate increased with pitching distance, and the vertical and horizontal break of the pitch increased with pitching distance. There was no difference in the pitching kinematics and no differences in the kinetics. So in conclusion, youth pitchers, if we lower the mound, it would likely have no effect on the risk of pitching injury. And an intermediate distance is a good idea when available, but does not seem to be necessary. As far as adults, lowering the mound would have no effect on performance and may reduce the risk of injury. And increasing pitch distance would have no effect on risk of injury. And as far as the effect on performance, it's unclear, as batters would have more time, but the pitch would also break more. Last thing I want to say is 5 p.m. tonight Eastern Time, we have a business meeting of American Baseball Biomechanics Society. As ASB attendees, you are welcome to come. You can find more about this at ASB or on the baseballbiomechanics.org website.
All right, well, thank you for that presentation. So again, I just want to remind everyone that we will have questions and answers after all 4 speakers have started. So our next speaker is Kate Harrison. She's from the BOA Laboratory, and their talk is on the influence of alternative shoe fit configuration on athlete biomechanics.
Hi, thanks so much for having me. I'm excited to present some work we've done with our partners at the University of Denver Human Dynamics Lab on the effect of shoe uppers on athlete performance and biomechanics. We all know there's been a lot of research that's gone into footwear development in regards to injury and performance over the past decades, but most of this research has traditionally focused on midsole and outsole characteristics, whereas not a lot of work has been done in regards to looking at how the shoe upper affects athletes. We did some initial work that actually showed that uppers designed to better conform to the top of the foot resulted in improved agility performance, specifically faster time to change direction and less mechanical work to change direction. And that's currently available as a preprint. So the purpose of this follow-up study was to quantify the joint level biomechanics to try to get a better understanding of how those improvements in performance came about. We analyzed that same data set where 31 NCAA athletes performed counter movement jumps and lateral skater jumps in 4 different shoe conditions. Our control condition was a standard lace tennis shoe. And then we retrofitted that same bottom package with the BOA Fit system in 3 different configurations. In the lace replacement, we mimicked the lace pattern, but we used lower friction guides and laces that are designed to more evenly distribute tension across the instep. And then the Y-wrap and tri-panel models use flexible panels that are designed to better conform to the shape of the foot. In each condition, we measured joint range of motion and peak joint moments at the ankle and knee in the frontal and sagittal plane. What we expected to see was greater range of motion and peak joint moment in the intended direction of motion, whereas we expected to see reduced range of motion and joint moment in directions that the athlete was not intending to move. So looking at counter movement jumps, starting with the ankle, as we expected in the Y-wrap and tri-panel configurations, we saw increase in peak plantar flexion moment. And then in the frontal plane, again, in line with our hypothesis, we saw a decrease in frontal plane range of motion, as well as the peak eversion moment. Looking at the knee, we again saw increase in sagittal plane range of motion and peak extension moment in 2 of 3 configurations in each case. And then in all of our alternative fit configurations, we saw a decrease in frontal plane range of motion at the knee. Looking at lateral skater jumps, we want to keep in mind that in this movement, you need to produce both vertical and horizontal force to optimize the center of mass trajectory for horizontal distance. And so again, we saw an increase in peak plantar flexion moment in all configurations, as well as an increase in the peak eversion moment. We actually saw still a decrease in the frontal plane range of motion, which could indicate reduction in risk of ankle sprain. And then looking at the knee, we saw an increase in 2 configurations in the peak extension moment again, despite an increase in or decrease in range of motion in some cases. And then in the lace replacement model, saw a decrease in the frontal plane range of motion and the peak adduction moment, which could have, again, a protective effect, this time in regards to ACL. So to sum up, in all alternative fit configurations, we did see an increase in joint moments in the desired plane of motion. So things like increased plantar flexion moment and knee extension moment have been associated with faster time to change direction and greater jump height. So that helps to explain the performance improvements we saw in our initial study. We also saw reduced out-of-plane joint moments, which does help to explain why movement was more mechanically efficient. And lastly, we saw a decrease in frontal plane range of motion at the ankle and the knee, as well as a decrease in the knee adduction moment in some cases, which suggests there's potentially an added benefit in addition to performance of reduced injury risk, specifically ankle sprain and ACL injury. So going forward, we definitely need to dive deeper into understanding the mechanism of improved performance. And so 2 paths we'd like to follow are looking at how the upper affects the interaction of the foot and the midsole and outsole technology. And secondly, looking at how the upper might affect athlete proprioception and allow them to more effectively direct their force and motion. So thank you so much for your time.
All right, thank you, Kate. So we're going to move on to our next speaker, who is Alex Lurski from the Army Research Laboratory, and their talk is entitled Performance Evaluation of Rate-Activated Tether Football Helmets. Thank you, Alex.
All right, hello everyone. I'm Alex, a contract engineer for the United States Army Research Lab, and I will be sharing some unique, exciting helmet technology with you today. As I'm sure most of you are aware, American football can be a dangerous sport, especially when it comes to impacts to the head and traumatic brain injury. Football has taken a great interest in making the game safer by improving the helmet's ability to mitigate energy during these violent impacts. The Army has taken similar interest in improving energy attenuation inside helmets to make our soldiers safer, especially our paratroopers. During failed parachute landing falls, paratroopers' heads can impact the ground at high speeds. A safer helmet would not only decrease the amount of TBIs in sports, but also in the military. We have developed a new industry-disruptive approach to energy attenuation inside of a helmet. The helmet suspension system is based on an Army-developed technology called the Rate-Activated Tether, or a RAT. Think of a RAT as a highly engineered speed-sensitive bungee cord that has special force characteristics. At slow speeds, when you pull on the ends of the RAT, it has very little force output. At high speeds, it has a very high force output. That, along with a steady force plateau over a large stroke, gives it the characteristics of an ideal energy absorber. Using this knowledge, we designed a helmet that uses RAT technology. We started small, focusing on just impacts to the rear of the head, keeping the paratroopers in mind. To construct the RAT helmet, we first removed the rear pads from a conventional football helmet and inserted a RAT suspension, which was designed to saddle the rear of the head. During a rear impact, the RAT extends. We conducted an industry-standard NOXI rear impact test. The video you see is the high velocity impact requirement. The test uses a metric called severity index, which measures the helmet's ability to reduce impact forces by integrating acceleration over time. The RAT helmet's performance at the higher velocity was tremendous, with a significant reduction of the SI score when compared to the conventional padded helmet. On top of the RAT having the properties of an ideal energy absorber, the RAT works in tension, which gives it 2 more advantages over conventional pads. First, the RAT engages with the head earlier in the event than the pads, as you can see in the head acceleration versus displacement graph and in the diagrams. At this head displacement, the RAT is already performing high levels of energy absorption where the pads have barely engaged the head. Second, the RAT has more available stroke to work with, since they don't compress until densification and take up space like conventional pads. In the chart and in the diagram, you can see when the pads are done absorbing energy, they still take up a relatively large amount of space. At this head displacement, the RAT continues to stretch and absorb energy. In conclusion, we've shown that RATs have the capability to become an industry-disruptive helmet attenuation system. We are currently working to implement the RATs into military and sports helmets. We are always looking for new application of RAT technologies, as well as partners for industrialization and product development. Thank you everyone for tuning in.
All right, thank you very much, Alex. All right, and our final speaker for this part of the session is Chenxi Yan, and they will be discussing tibial bone strains in basketball players during dynamic tasks.
Hello everyone, today I will be presenting my study, tibial bone strain in basketball players during dynamic tasks. Physical exercise brings numerous benefits to our body. Meanwhile, overtraining or exercise with improper form could increase the risk of sports-related injuries. One thing that not many people know is that even during walking or running, our shin bone is being bent due to the loads acting on it. For professional athletes who participate in sports with much higher intensity, such as track and field, basketball, their bones undergo greater load and might have less rest time due to frequent competition. It is like a wire being bent back and forth repetitively, and eventually it will cause failure. So can their bone always handle this repetitive loading without any problem? Not always. Therefore, the goal of our study is to investigate the load and strain distribution on the tibia bone during multiple basketball movements. In our study, we recruited 13 college-level basketball players to perform several common basketball movements, including sprinting, jumping, lateral shuffling, and etc. While performing activities, reflective markers were attached on their body so that the motion can be captured and analyzed with the force play data through computer software. And all the loads acting on the tibia bone during the stance phase of the activities can be extracted and further analyzed. Meanwhile, computer tomography scan of each subject's lower limbs were obtained. Finite element models of the tibia bone for each subject with their bone properties were built. There were 2 boundary conditions applied on the model. At the proximal end, the surface nodes were fixed in the space, and at the distal end, the model was fixed by a spring with limited range of motion. Finally, during the simulation, the loads acting on the bone at each time frame during the stance phase were applied on the model. And we specifically aim at 2 10mm thick sections at the middle and distal third part of the model for string analysis. So far, we have analyzed 4 different movements, and here is an example of sprinting. The plot shows the medium tensile and compressive strength through the stance phase. The strain gradually reached its peak and then diminished as the stance phase ends. If we take a closer look at the middle section, we can see the strain distribution across the transverse plane during the stance phase and find out when and where does the peak strain occur in this particular region. As we compare the peak strains between 4 current activities among all the subjects, sprinting resulted in the greatest tension across the whole section. In the anterior quadrant alone, we found that jumping also yielded great tensile strain compared to other movements. For the compressive strain, sprinting generated the greatest strain across the whole section again, while jumping generated the greatest strain in the anterior quadrant. In general, the bone experienced greater compressive strength than the tensile in terms of magnitude. Overall, by comparing different activities, we found that the peak strain occur at a different time point with respect to different sports, and we can see from this plot of the medium strings as different activities have different shapes. Moreover, the peak tensile and compressive strain do not necessarily occur at the same time. Based on the strain failure criteria, most activities did not yield strain that close to the fracture limit. And currently, we divide the bone section into 4 anatomical regions as anterior, posterior, medial, and lateral. However, based on our collaborators' clinical experience, we're currently considering to analyze the strain in a more continuous fashion. On the other hand, we will also consider the effect of fatigue on the strain distribution and also individuals' kinematic patterns on the movements in the future. At the end, I'd like to thank my lab members and my funding source for the support of this study. Thank you.
Thank you to all the presenters. We now have time for some questions that have been posted in the chat. The first one is to Alex from Zane. Would the rat wear down and lose any stiffness over months of use and multiple impacts? And how often would the straps need to be replaced?
Yeah, so we haven't done any official testing on the longevity of rats, but I've been working with the same rats for months at a time, and there's been no evidence of wearing down over time.
And Kate, I know you've been answering some questions in the chat room, but I thought it might be good for you to talk about, do you think the trends that you found will be similar in walking and running versus the more explosive type of movements that you analyzed? I know you've got work in progress. Maybe you can share with us.
Yeah. So we did start with more explosive moments. We thought that would be kind of the most obvious place to start where the differences would be largest. We do think those similar changes would translate down to lower intensity movements like walking and running. And so we are doing studies currently to follow up on those questions. And yeah, we look forward to sharing those results when we've got them.
Any other questions for our presenters?
Well,
Go ahead, Kirsten.
Oh, no, I was going to present something to Glenn. So you looked at all the different various conditions. What do you think would be most impactful on your findings? Is it mound height? Is it pitching distance? And what would you kind of want to see changed?
Well, I presented adults and kids. For the adult side, Major League Baseball wants more exciting offense. I think moving the mound back would have more chance of giving more offense than lowering the mound. I don't think lowering the mound would have as big a factor. They did lower the mound in 1968, but they made other changes also. And back in 1968, they didn't ask me my opinion because I was in first grade. But as far as the kids go, it actually is happening right now. There are little leagues with different distance pitching and different height mounds and stuff. And I think the take-home message is, you know, once upon a time, you're a little kid throwing 46 feet, and then next year you're gonna throw 60 feet, and it looks like a mile away. And so some towns have these intermediate distance leagues, fields available, 54 feet. And I think our research shows that when available, that's a better transition to do a year at the intermediate distance if you can. But some towns can't afford that.
So I have a question for you, Chenxi, about your work and the stress responses in tibia.
Yes.
And I think you reported that you found different results for different tasks.
Yeah.
And I was wondering if you could share with us if there was some relationship between the different patterns and the reaction forces that were experienced in each of those tasks.
Okay, right now we have analyzed, fully analyzed around 4 exercises. So I say between walking and sprinting, the way the peak shows up or shifting is kind of similar, but like I presented, jumping has a different pattern than sprint. Also, the lateral sprint is also a different type of loading. So I think by far only walking and sprinting share some similarities because they're all in the same directions or the way you propel yourself. Other tools have different mechanism to move your body, so the strain patterns are different. Also, the time point that peak strain occurs are different.
Are those time of peaks related to the reaction forces or more towards other components?
Not necessarily. It also matters with each player's their habit. So not like walking a pretty universal pattern, but like jumping and lateral shuffling, they have their own style. So not even the time point would be the same for all subjects. So yeah.
We also had a follow-up question from Naomi. And there was a question about how you actually measure bone strain in vivo in real time.
We did not measure the in vivo strain. We built the finite element model, but back in the, I think early in the 90s or 2000, there's some in vivo measurements that you actually do a surgery and put the strain gauge onto the bone, and then you perform different tasks, but not really very difficult tasks because I think it's kind of hard to do with the strain gauging of bone. So there are in vivo tasks, yeah, but
Thank
we're
you.
doing simulations.
We have another question from Glenn, following up on MLB's goal of increasing offense. I believe this is counter to their other goal of reducing time of play. What were the opinions of pitchers on this seemingly disadvantage on their end?
Well, first of all, I've talked to MLB, the commissioner's office, but I haven't talked to the pitchers about this. And I agree. I do not think the pitchers would be in favor of moving the mound back. The pitchers today throw much faster than they did in the past, 95 miles per hour. And I think this is a balance between pitchers and hitters. And again, without the pitchers liking it, they might do it. But you do have a good point. It might make the game longer. But I think there's a trade-off. More offense at the cost of a little more time might be something they consider.
There's also another question for Alex. Have you measured angular acceleration and velocity?
So for the NOXY test, you don't need to, but we've done other industry standard tests. And for those, you have to measure angular acceleration and velocity. And we've seen some success with those metrics as well.
And Kate, I can't remember if you mentioned this, but this is a question from Gillian. Were you able to look at foot versus shoe motion in your study when comparing lacing conditions, i.e. markers on foot and markers on shoe?
That was a great question. And unfortunately, that wasn't something we were able to capture since the focus of the study was on the upper. We really wanted to leave the upper intact, so we weren't able to put markers on the foot. But that's definitely something we've been thinking about and are trying to follow up on so we can kind of get down and understand that better.
Great. Thanks everyone for chiming in for some questions. I'm sure we can continue this conversation after the session. We're right about on time, so we can be ready for the next 4 presenters. The first presentation will be by Cherice.
Can everybody hear me now? Sorry for the delay. Good morning, everyone. Thanks for coming out for this presentation. I'd like to talk to you guys a little bit about part of my dissertation research focused on understanding racial differences and running and landing measures. So running and landing have been commonly associated with risk of both overuse injuries, such as stress fractures, and impact injuries, such as tendon ruptures and ACL injury. And there are also some fairly well-documented racial disparities in injury incidence rates, some of which occur in some of the same diseases or injuries, that have been previously associated with running and landing. But outside of elite athletes, there really isn't a lot of research looking into whether there are racial differences in running and landing measures that may create differences in injury risk between racial populations, which in turn may contribute to some of these racial disparities and injury incidence rates that we see in the literature. So the purpose of this study was to test the hypothesis that one, racial differences exist in running and landing mechanics between African Americans and white Americans, and also that racial differences could be explained by anthropometric, strength, and health status factors in women but not in men. And really the rationale for this second purpose was that we hypothesized that if racial differences do exist in movement mechanics, it wouldn't be due to simple racial classification itself, but that there would be some underlying measure that would be driving those racial differences. So we recruited a total of 92 participants, and all participants completed a biomechanical assessment during which 3D motion capture and force plate data were recorded during running and during a drop vertical jump landing task. We also collected venous blood draw, anthropometric measures, other health status metrics, and lower extremity strength data from all of our participants. Before analysis, we separated all of the data by gender, and we utilized multivariate and post-hoc univariate ANOVA models to identify racial differences in our running and landing outcome measures. For any outcome measure that did differ between race for that particular gender, we followed up with a stepwise mixed linear regression model, including race and any other independent variable that was also significantly correlated with that outcome measure. And the purpose of this second step was to try to identify other independent variables fitting into those anthropometric strength and health status categories, which may contribute to or help explain any racial differences that we see. And if after the inclusion of those other independent variables, race was no longer significant in our regression model, we interpreted that to mean that those other independent variables contributed to or explained the racial effect on that outcome measure. So this is a complete list of the dependent variables that we included in our study. For the sake of time, I won't go through all of these in a lot of detail, but we did include temporal, kinetic, and kinematic measures in running, and kinematic and kinetic measures during the drop vertical jump landing task. This is a full list of the independent variables that we included, again, in those anthropometric strength and health status categories. And if you'd like to have more conversation about why we chose these particular measures, feel free to ask, and I'd love to have those conversations with you guys. So on to the results. In running, we saw racial differences in both men and women, with African American men running with larger peak vertical ground reaction forces and smaller peak hip adduction angles compared to white American men. But neither one of those racial differences in men during running were able to be explained by any of the independent variables included in our analysis. For women, we saw longer stance times in African American women compared to white American women, which was partially but not completely explained by higher resting heart rates and larger curl indices in African American women, with curl index being defined as the ratio between your tibia length and femur length. In landing, we actually only saw racial differences in women, with African American women landing with larger peak vertical ground reaction force, larger loading rates, and larger frontal plane knee range of motion. The racial differences in ground reaction force and loading rates were explained by some combination of African American women being shorter and having higher levels of chronic perceived stress compared to white American women. And the larger frontal plane knee ranges of motion were explained by larger BMI and smaller knee flexion strength or weaker knee flexion strength in African American women compared to white American women. So our overall takeaways from this study were that running and landing mechanics do differ between racial groups and vary by gender. And this study for us was really kind of a first step to hopefully inform a lot of future studies, including race a little bit more intentionally in biomechanics research. And based on our study findings, we do think that it's important to prioritize racial diversity in study samples and not necessarily assume that movement mechanics are not impacted by racial or ethnic group. We also think that it's very important based on these findings to really be intentional in our study design and our methods of translating research back to various populations, ensuring that we're maximizing equity of research impact for both majority and minority populations. And lastly, racial differences in running and landing mechanics may be useful in addressing racial health disparities and injury incidence rates moving forward in running and landing related injuries. And with that, I'd just like to thank everyone who was instrumental in allowing this project to happen. And I'd like to thank you all for listening.
Great, thank you. Our next presenter in this section, it will be Joshua.
Welcome. Today I'll be speaking on the effects of anticipation and external targets on knee biomechanics during a volleyball block landing task. This project was completed as part of Michael O'Dwyer's thesis at the University of Tennessee. As we all know, ACL injuries are a debilitating injury that have long-lasting effects. In the sport of volleyball in particular, ACL ruptures account for nearly 26% of all severe injuries. There are several knee kinematic and kinetic variables that have been identified as ACL injury risk factors during landing, especially landings that involve a secondary rotational movement. These include increased knee abduction angle and moment, decreased knee flexion angle at initial contact, and increased proximal tibial anterior shear force. Additionally, a primary concern in biomechanics research is the lack of realism in the testing environment. It has been shown that including external objects or unanticipated tasks creates a more game-like scenario. However, it is currently unknown how including both an external object and an unanticipated secondary movement affects knee biomechanics during a volleyball-specific block landing. Therefore, the purpose of this study was to determine the effects of a physical overhead goal and a subsequent unanticipated lateral cut on knee kinematics and kinetics during the landing of a volleyball block. This study included 14 recreationally active females who had a minimum of 2 years of high school volleyball experience. Marker coordinate data was collected on the lower extremities, and ground reaction forces were collected underneath both the right and left foot during all tasks. Knee kinematics and kinetics were computed using Visual 3D. The task consisted of the athletes taking a two-step approach onto the force plates. They then subsequently completed a maximum vertical jump, simulating a blocking task at the apex of their jump. Upon landing on the force plates, they then performed an immediate lateral cut off of the right leg to the left. Participants completed 4 different conditions. The first, control condition, contained no overhead goal and was an anticipated movement. The second condition included an unanticipated component, where the participants were presented with a visual stimulus at the apex of their jump that indicated they were either to cut to the left, cut to the right, or perform a subsequent rebound vertical jump after landing. The third condition introduced the external object, where a volleyball net was placed in front of the participant and a volleyball was suspended above the net, in which the participants performed their blocking task on. Finally, the fourth condition incorporated both the external object of the volleyball and the net, along with the unanticipated movement condition. These four conditions were compared using a 2x2 ANOVA, where we analyzed initial contact knee angles, peak knee angles during the stance phase, and peak knee moments. Our results indicated that creating a more realistic testing environment by including external targets and unanticipated movements altered knee landing mechanics and may allow for better evaluation of ACL injury risk factors in female volleyball players. Females landed in a more erect posture, as well as experienced greater sagittal plane knee loading when a target was present, giving a potentially better representation of the loads that are sustained during gameplay. Changing the testing environment so it better represents gameplay can improve the methods researchers use to find more conclusive evidence in the mechanisms of ACL injury in female volleyball players. While including a target did result in altered knee biomechanics, using an unanticipated secondary movement resulted in a larger number of biomechanical changes, suggesting that it may be more important to include decision-making tasks in the testing environment to better simulate gameplay. I'd like to again acknowledge Michael O'Dwyer for the outstanding job he did on this thesis project, and Lauren Schroeder for her invaluable assistance. I'd also like to thank the organizing committee for all the hard work they have put in to make sure we were still able to have the ASB meeting this year.
Thank you. Next up is Lauren.
All right, can you hear me now?
Yes.
Okay. Hi, I'm Lauren Biscardi, and our research is about how running to a fractal-like stimulus can preserve the complexity and stride-to-stride fluctuations. So variability is inherent in human motion, and it's very apparent in repetitive tasks like running. Over the span of a run, you see small differences in stride intervals, and within these fluctuations, patterns exist. We can gain insight to the control of the locomotor system by studying the fluctuations in these patterns. And the reason we can do so is because what we're seeing reflected in these fluctuations is all the body's different parts and processes that work together to produce a single stride. So the fluctuations that we see are a result of a healthy system's multiple ways to achieve a single stride. And we can manipulate the patterns that we see through external pacing strategies. There's clinical and practical applications, and most often we use metronomes. Typically, you're going to see use of a metronome to run a little bit faster than self-preferred cadence, where it's going to influence running form by taking your stride and placing it closer to the center of mass when it hits the ground. This is going to affect our running form by placing that initial foot strike closer to the center of mass, and it can help beginners with their attentional focus, and it can act as a stimulus to maintain pace as a runner begins to fatigue. So the tool that we're going to use to study these patterns is called detrended fluctuation analysis. And what that allows us to do is first isolate those fluctuations in our running patterns, then take a look at small, medium, and large groups of strides and the fluctuations that occur around these particular groups and groupings of strides, and then put together a plot where the slope will give us an indication about the complexity of our stride interval fluctuations. In a self-preferred running pace, we see what's called a fractal pattern, which means those fluctuations around small, medium, and large groupings of strides are going to share similar statistical properties. When we see a loss in this fractal pattern, what we can say is functional control of movement is going to start to break down. So in our clinical and practical settings, when we use a metronome, we see a breakdown in those fractal patterns. Most often what we use is a periodic metronome with no variability. So when we take our strides that have natural predictable fluctuations and try to constrain them to this inflexible tempo, we see a loss of adaptability in that locomotor control system. So we sought to design a study where we manipulated the temporal structure of a metronome to match those natural fluctuations that we normally see when we're running. And we hypothesized that we could preserve the stride complexity by manipulating that temporal structure and matching it to that more natural fractal-like pattern we traditionally see. So we had our participants run under 4 conditions. First, self-paced, so that we can take a look at their natural stride patterns and calculate their mean stride time. We used that to design our stimulus, which was periodic, random, and fractal tempo conditions. And this metronome is projected, you can see it on the right-hand side of the screen, in front of the participant. They were asked to match their foot strike to the moving metronome. We made sure to include both a fractal and a random temporal structure to show that the structure of the variability matters, and we validated the predictability by using our detrended fluctuation analysis. We had 13 male participants, and the setup is indicated on the right-hand side in that video. We had 3 sessions. In our first, we had a baseline session where we determined our cardiovascular parameters that determined the speed at which the participants ran. In our second and third experimental conditions, we began with our self-paced running, and then we randomized our cued conditions. The treadmill runs were at a high intensity pace for about 8 minutes. We used detrended fluctuation analysis to study the patterns in our stride intervals, and we used repeated measures in ANOVA to compare our different conditions. So our results and our findings supported our hypothesis. On the right-hand side, in pink, you can see our self-paced patterns, and on our left-hand side in green, we see our fractal patterns. No statistically significant differences indicate that running to this fractal-like stimulus is going to preserve the complexity and patterns that we see in our self-paced running. In orange and purple, our periodic and random conditions, we see a shift or a breakdown in that fractal-like pattern. So this has important implications in our clinical and practical settings, and it suggests that using a fractal structured metronome is a viable strategy to preserve these gait complexity patterns in our running strides. In our next steps, we want to see what impact matching this fractal pattern has on our cardiovascular parameters of running. And finally, our goal is to produce this on the right-hand side of the screen in a portable over-the-ground capacity so that we can use this in our clinical and practical settings easily. Thank you.
Thank you. Our next presentation is by Namwoong. It'll be a video recording. Thank you.
Nebraska, Omaha. I'd like to talk about my research titled Muscle Contributions to Lesion Reaction Forces and Moments During Single Leg Landing. 70 to 80% of ACL injuries occur during landing or cutting. Knee joint loading such as valgus moment, anterior shear force, and internal rotation moment have been associated with increased risk of ACL injury. Muscle forces are one of the primary factors in determining knee joint loading during dynamic movements. Therefore, understanding the role of each individual muscles and their contributions to knee joint loading during dynamic movements may help to develop interventions to help prevent ACL injury. However, individual muscle contributions to knee joint loading during dynamic movements is not easily quantifiable, although it's really important information to develop preventative or rehabilitative interventions. Therefore, the purpose of this study was to identify individual muscle contributions to anterior shear forces, frontal plane moments, and transverse plane moments at the knee joint during single leg landing. 10 healthy adults participated in this study, and they performed 3 successful trials of single leg landings from a 45 centimeter box. Open seams induced acceleration analysis was used. The reason why we use musculoskeletal modeling along with induced acceleration analysis was to address our aim of this study, again, that is to quantify individual muscle contributions to knee joint loading. But when you look at figure 1, we use a total of 6 steps to quantify individual muscle contributions to the knee joint loading during single leg landing. For someone who are not familiar with induced acceleration analysis, induced acceleration analysis is a method to calculate acceleration caused or induced by individual forces acting on a body. For example, we can quantify individual muscle contributions to mass center acceleration during dynamic movements. Let's move on to results. When you look at figure 2 on the left side, figure 2 represents individual muscle contributions of knee spanning muscles to knee joint loading during single leg landing. In this study, we analyzed a total of 7 lower extremity muscles. And the gray shaded area represents a total loading, and each individual line, each colorful line represents individual muscle contributions to knee joint loading. And x-axis represents weight acceptance phase. Weight acceptance phase refers to initial contact to peak ground reaction force. To summarize the results, the lateral gastrocnemius contribute to the most to anterior shear force. The medial gastrocnemius and the medial hamstrings contribute to the most to varus moment. The biceps femoris long head contribute to the most to external rotation moment. The reason why we reported muscle contributions to varus moment and external rotation moment is because this moment can cancel out valgus moment and internal rotation moment, which may help prevent ACL injury. Now, I would like to talk about how this information incorporated into preventative interventions. The medial gastrocnemius, medial hamstrings, and biceps femoris long head have great potential to reduce the risk of ACL injury by providing varus moment and external rotation moment during single leg landing. Interventions targeting these muscles may be necessary to prevent ACL injuries because of their ability to resist the valgus moment and internal rotation moment. Future analysis was required to study contributions of non-knee spanning muscles, as these muscles have been shown to play an important role in determining knee joint loading during dynamic movement. Thank you for listening.
Thank you. I think we're ready for questions.
All right, so thank you everyone for the great presentation. So I wanted to start, I know there's a lot of spirited discussions going on in the chat, but I wanted to ask Cherice, what were kind of the rationale for a couple of the measures? I know you noticed you some unique biomarkers, so what was the rationale for the measures that you used?
Sure. So when we started the study, we struggled a bit just based on there being very limited prior literature. So we, a lot of those measures were kind of just based on us thinking about what we were hypothesizing could impact movement more generally. This was also part of a larger study also including walking. So we weren't only running and landing focused in our, in these independent variables. We hypothesized that any factors driving racial differences would include both physical attributes and social attributes, which is why we had some anthropometric measures and also had things like stress questionnaires. The particular biomarkers that we chose, we selected as a combination of indicators of stress, things like cortisol, and also some inflammatory biomarkers that we thought might be interesting in terms of kind of systemic inflammatory responses that may also impact the joints. So I don't know if I fully reinforced, but this was kind of for us like a first stab in order to inform lots of future projects. So I think it kind of left more questions than answers, which was kind of the intention, and now we're hoping to follow up with a lot of those.
Yes, that happens a lot, more questions than answers a lot of time in research. So Josh, I wanted to follow up with a question for you. How did you look at upper body biomechanics, and how were those kind of differentiated between the anticipated and unanticipated conditions?
We did not look at upper body. This was just a pelvis and right and left leg analysis. That's something that maybe we should consider in the future when we're doing like a volleyball blocking test, which definitely has an upper body component to it.
Okay. Thank you. That was interesting. I enjoyed the study. So one of the next questions I wanted to talk with was directed at Lauren. And so one of the questions was, do you have any insights on how metabolic rate changed across the conditions and if it was correlated with the detrended fluctuation analysis results?
So that's one of the next things that we would look into. We monitored their oxygen uptake to make sure that each participant was running at a physiologically individualized pace. So they're running at a high intensity pace, which is typical of a tempo run if you go on distance runs. And we made sure everyone physiologically kept that pace up, but we would like to look at the metabolic rate and additionally any other types of cardiovascular changes across conditions.
Oh, thank you. So Namwoong, we wanted to see where the single leg landings performed with the free leg as visually presented in figure 1. Was this naturally selected by the participants? I think you're muted if you're responding. But we might move on to some other questions. Okay, yes, yeah, so sorry, he is unable to log in at this time. So as I kind of redirect through some of these, Lauren, why was it preferred to use a mobile visual display instead of a sound for the runners to listen to?
So there are a few different benefits to using a visual projection rather than an auditory metronome. And one of the things is being able to anticipate rather than react to the stimulus that you're seeing. So if the tempo is varied, you can actually anticipate with that moving bar a little bit better than if you're reacting to an auditory metronome. And then additionally, there could be benefits for attentional focus as well, if you're looking at the visual rather than auditory.
Okay, thank you. And then Josh, we wanted to follow up with, was there any kind of changes you'd want to make to the current study? Someone suggested using a setter, but would there be any modification to how to influence the biomechanics?
Yeah, good question. Yeah, I think obviously the more that we can make the task realistic within the lab environment, the better that we're going to be, the closer our lab experiment results are going to be to real life game situations. We've done some of that in overground run and cut type tasks where we've introduced a live defender in the testing environment. With ball sports or court sports, it's a little bit more of a challenge. Not exactly comfortable having a ball flying around the motion capture space right now. So, but I think there might be some other avenues that we can take using some wearable technology to actually go to the athlete rather than bring them into the lab. That might be the better approach.
Yeah, thank you. So we're going to try back with Namwoong. We wanted to see what was kind of the rationale for the single leg that you used to perform the study. Was this a kind of the naturally preferred leg for the participants? All right. And we will continue on. So I think with that, we might be around time. So thank you all. We'll continue these discussions in the chat, but also we're moving a lot of these questions to the Slack channel. So if you don't see it here, that's likely where your questions are going to be asked and answered. So thank you again for the speakers. So our final session is going to start with Anna Ursini from the University of Vermont. And their talk is entitled, Does Sex Influence Interpretations of Control Complexity via Muscle Synergy Analysis?
Hi everyone, my name is Anna Ursini, and in this presentation I will be discussing the influence of gender on interpretations of motor control complexity via muscle synergy analysis. So muscle synergy analysis during Gait has been proposed for exploring the effects of neurological impairment on motor control, as seen in the two pieces of literature shown here. A study done in 2013 explored persons with Parkinson's disease, as well as a more recent study in 2015 pertaining to children with cerebral palsy, have both shown a lesser number of muscle synergies is required to explain some threshold percentage, in this case 95%, of the variance accounted for in measured muscle excitation through populations with neurological impairments as compared to unimpaired populations. So this observation is thought to indicate a less complex motor control strategy attributed to the neurological impairments central to these studies. And these conclusions assume that the observed differences are not confounded by other variables such as sex and age. However, it's been shown in studies examining runners with iliotibial syndrome and post-ACL reconstruction patients that sex can influence observed gait mechanics in impaired populations, and that sex may impact motor control in activities other than gait. These results provide a basis for questioning the assumption that sex does not influence conclusions concerning motor control complexity via muscle synergy analysis. The reason this hypothesis was of interest to our lab is because an understanding of the potential influence of sex on muscle synergy analysis during gait is necessary for clinical interpretation. However, this has not been tested directly. So thus, in this study, we explored the effect of sex on muscle synergy analysis during gait, and I will be presenting preliminary results suggesting the effect of sex is not significant. Surface EMGs sampled at 1,000 hertz of these 10 muscles of the right leg were recorded for 16 unimpaired subjects, of which 10 were males and 6 were females. Each subject completed a 1-minute level walking trial on a treadmill at a self-selected speed. Next, 1 to 9 synergies were extracted from all subjects to consider all possible synergy configurations. And then we compared the synergy analyses of males and females similar to how previous studies have compared impaired and unimpaired populations. For each participant, we also computed the total VAF across all muscles for each number of synergies extracted. This figure illustrates a similar trend in the average total VAF with respect to the number of synergies extracted for both males and females. Independent t-tests showed these differences were insignificant, and previous research has shown that impaired populations will exceed a given VAF threshold with significantly fewer synergies than unimpaired populations, which has been interpreted as a less complex control strategy for the impaired population. We performed a similar comparison between males and females using a VAF threshold of 95%, and we found no differences between males and females. In addition, we also compared muscle-specific VAF for the 4 and 5 synergy configurations using independent t-tests for each muscle. On the left, you'll find the results for the 4 synergy configuration, and on the right are the results for the 5 synergy configuration. In summary, there were no significant differences between males and females in VAF for any muscles for the 4 or 5 synergy configuration. Similar analyses have shown significant differences in muscle-specific VAF between impaired and unimpaired populations. Therefore, our results suggest that sex may not have been a confounding factor. To summarize, our preliminary results suggest that sex does not significantly influence interpretation of motor control complexity via muscle synergy analysis. From a clinical perspective, this is worthy of attention as it eliminates the need for a medical professional to consider sex when assessing a patient's motor impairment. And in order to further validate our preliminary analysis, it will require analyzing a larger sample while maintaining the unimpaired status of our subjects. Thank you.
All right, thank you. Our next presenter is Mitchell St. Pierre from Georgia Institute of Technology, and their talk is on the effect of transcutaneous vagus nerve stimulation on visuomotor skill learning in humans.
Awesome. All right, let's get this shared. And everyone can see that? Okie doke. Okay, let's get started. My name is Mitchell St. Pierre, working under Dr. Minoru Shinohara at Georgia Tech. Today, I'll be overviewing our project titled Effect of Transcutaneous Vagus Nerve Stimulation on Visuomotor Skill Learning in Humans. So, loss of functional movement can occur with advanced age and with neuromotor disorders such as stroke and spinal cord injury. It's possible that pairing neuromodulatory interventions with training may enhance the effects of rehabilitation. In rat stroke models, afferent vagus nerve stimulation, or VNS, with implanted electrodes promoted motor recovery when VNS was applied during rehabilitation exercise. It's presumed that stimulation of afferent vagus nerve connecting to the brainstem affects neuromodulators in the cortex and consequently neuromotor performance and adaptation. The diagram above overviews one common method of transcutaneous VNS or TVNS as a way to translate from invasive VNS in rats to humans. Here, electrical stimulation at the tragus leads to excitation of an afferent branch of the vagus nerve, ultimately exciting higher cortical regions. So the purpose of the study was to examine the potential effects of pairing TVNS with motor training on motor skill improvements in healthy young humans. We hypothesized that motor skill improvement was altered with TVNS that is paired with the execution of the training task. So 16 healthy young adults were assigned to either the TVNS group or sham group pseudo-randomly. Subjects trained for 170 trials over the span of 5 days, with weak electrical stimulation administered to the outer ear during each trial. As depicted in the top left picture, subjects in the TVNS group received stimulation at the tragus, while those in the sham group received stimulation at the earlobe. The visual motor task consists of using index and little finger abduction forces to push against force sensors, as shown in the bottom left picture, and accurately follow complex trajectories below 10% of their maximum forces. The trials on the right show the target pattern in blue, with the index finger forces in green and little finger forces in red. And here you can see the typical improvement after the training period. This skill was also tested each day without electrical stimulation. So to assess the progress of skill learning, the root mean square error, or RMSE, was tested. The initial test performance had comparable RMSE between groups. In the top right figure, RMSE normalized to this initial performance in the TVNS group is shown in green, and the sham group in orange. From day 2 to day 5, the TVNS group showed higher RMSE compared with the sham group by about 20% across days on average. And the difference was prominent in the initial days. After the training period, the average reduction in RMSE of the practice trajectories was comparable across groups. So to examine the transfer of learned motor skills, subjects were additionally tested on tracking a non-practiced square wave trajectory on the first and last test days without electrical stimulation. The bottom right figure shows RMSE on day 5 normalized to day 1 RMSE in the same corresponding colors. Both groups had significant and comparable reductions in RMSE from the initial performance. These results indicate that the TVNS group had initial delays in improvements, while the final improvement and transfer of learned skill were comparable. So again, these results indicate that the application of TVNS during visuomotor skill training may delay the initial improvements of practice skill, while the final improvement is comparable to non-TVNS training in healthy young adults. The findings, contrary to those of implanted VNS and stroke rats, suggest the need to consider the specificity of the VNS procedure, the species, the health status of subjects, and even the motor task in understanding and expecting the effect of VNS on motor rehabilitation outcome. Thank you for joining me today for this presentation. If you have any questions, I'll answer them later. Thanks again.
Thank you for that talk. So our next speaker is Qashqai, also from Georgia Institute of Technology, and their talk is entitled Human Reaction and Movement Enhancement via Audio, Tactile, and Visual Perceptual Cues.
Can you hear me?
Yes.
All right, great. Sharing my screen now. Can you see the screen? Great, thank you. So hello, my name is Akash. Thanks for attending. This is human reaction and movement enhancement via audio, tactile, and visual perceptual cues. So to maximize safety, people are often physically separated from dangerous areas. However, in dynamic environments such as nature, natural disaster areas, and construction zones, this physical separation is not possible. There are many different ways to mitigate risk in dynamic environments, including risk assessment, human-robot teaming, and human-human teaming. These methods have had great success, but they don't address the inherent bottleneck of slow human perception. With the rise of increasingly advanced robotic vision systems and new strategies to identify danger, we have a wealth of information to help perceive critical threats. However, there's a gap in rapidly communicating this threat information. We can alert people through perceptual cues, which can include audio, visual, and tactile cues. Previous research has looked into a large array of tasks, but have not looked at how perceptual cues can influence dynamic movements. The dynamic movement we're interested in is planar dodging. We define it as a person standing in a relaxed position on a level plane, and after being notified at a random time that a threat is approaching, they move towards safety. We determined 2 performance metrics, including failure rate and reaction time. Failure rate was the percent of the time the person was unable to evade the threat, and reaction time was the time it took for the center of mass speed to exceed a nominal value. Our hypothesis was that the addition of tactile cues would improve human performance by reducing both reaction time and failure rate. To test this hypothesis, we developed a virtual reality environment where we could safely and consistently simulate threatening objects. The environment was a square room. The person was represented by a cylinder, and these large blue walls were the threats. The walls ensure that subjects move their entire center mass towards safety rather than ducking or swaying out of the way. And just to summarize our protocol, we had 18 subjects who completed 17 different conditions of different cue combinations. And these combinations would be different would be suggested dodge or object directions. And each condition was comprised of 27 trials of varying direction and difficulty. So as an example, so here we have a subject, they have a visual arrow telling them that a threat is behind them. It's a top-down visual arrow. And then this representation of a tactile belt is showing us that they're being buzzed from behind. And in this case, they're able to successfully evade and dodge to the left. So to test our hypothesis, we broke down all those different cue combinations into 6 groups shown in the figure. Tactile and visual cue responses showed decreased failure rates, while audio increased failure rate. Similar trends were seen in terms of reaction time, but were less pronounced. We can also look at the data in terms of direction. So here, a subject is suggested to move forward, and in the polar plot, closer values are better because they're lower failure rates, so they get hit less often. Observing the plot as a whole, we can see that people fail more moving in the sagittal plane as they evade frontal plane threats. If we think about associated escape times with these failure rates, that can be broken down into a reaction time and a movement time. Reaction time did not show a clear directional dependence. Movement time, however, the time it takes for a person to get out of the path of the threat after reacting, did show this directional dependence. So we observed a 30% higher movement time in the sagittal plane. So this indicates difficulty in moving the interior and posterior directions. It's a vulnerability, essentially. So in summary, we investigated the effects of perceptual cues on planar dodging. We found that a haptics belt provided the largest benefits and that people have a vulnerability in moving backwards and forwards. Finally, I'd like to acknowledge some of our talented undergraduates, fellow grad students in the DART and EPIC labs here at Georgia Tech, and also to our funding sources and the ASB organizers. Thank you.
All right, thank you. All right, and our final speaker for today is Anvesh Naik. I apologize for the pronunciation. He is from Purdue University, and their talk is entitled, "Should I Stay or Should I Go? Stability of Digital Forces is Lowered to Enhance Maneuverability when Expecting to Move a Pinched Object."
Hey, Christine. Hello, everyone. My name is Anvesh Naik, and I'm from Purdue University's Human Motor Behavior Group. Stability and maneuverability stability and maneuverability are the antagonistic attributes of a motor system. Stability is the ability to maintain a desired motor state. For example, while holding a glass of wine in a comfortable posture and not expecting any external perturbations, the finger forces exerted on the glass by these women would be stable. In contrast, maneuverability is the ability to transition between motor states. For example, while holding the wine glass and navigating through a crowd, individuals expect to swerve through the crowd to avoid external perturbations. Therefore, they would be in a state of readiness to alter finger forces to change the trajectory of the glass as needed in order to avoid contacting other people with the hand or the glass. Animals often lower stability to enhance maneuverability, and this is called the stability-maneuverability trade-off. This trade-off has been observed in animal locomotion and in human locomotion as well. However, it has not been studied in human prehension, although dexterous object manipulation is essential for activities of daily living. So we performed a manual target tracking experiment to study whether this trade-off is evident in object manipulation in humans. And the take-home message is that we observed the stability maneuverability trade-off in human prehension. 11 young healthy participants held an object with the thumb and the index finger of the dominant right hand and tracked a target with a cursor by moving the object vertically. We provided the object's position along the vertical direction as a visual feedback in the form of a cross on a computer screen which was placed in front of the participant. Participants performed steady tasks and reaction time tasks 15 times each in a block randomized fashion. In both tasks, a square target was provided on the screen. Participants were required to position the handheld object in front of them such that the cross was within the square target on the screen. In steady tasks, participants were told that the target will not move and therefore they had to hold the object stationary with the cross inside the square target. In reaction time tasks, participants were told that the target could jump either up or down at any moment and they were required to move the object as quickly as possible to track the target. The normal pressing force exerted by the digits on the object were recorded using force sensors and the position of the object was tracked using a motion capture system. We quantified the stability of normal forces in a 4-second window for steady tasks as shown here and during a 4-second window before the target jump in reaction time tasks as shown here using the uncontrolled manifold method. This period for reaction time tasks is known as the 4 period. It is a classic characteristic of human prehension that when an object is moved vertically, the normal pressing force, that is the grip force, increases to match the increased inertial load due to the object's acceleration. Therefore, during the 4 period of reaction time tasks, participants expect to change the normal finger forces. In contrast, participants do not expect to change forces during steady tasks. So reduction in the stability of current forces should assist in volitional rapid changes in forces. Therefore, we hypothesized that the stability of normal forces during the 4 period of the reaction time task would be lower compared to the stability during steady tasks. We computed relative stability as relative stability during reaction time tasks minus stability during steady tasks. Therefore, our hypothesis was that relative stability would be less than 0. We used reaction time computed during reaction time tasks as a measure of maneuverability. And consistent with the stability maneuverability trade-off, we hypothesized that participants who reduce their digit force stability will have lower reaction times. Our first hypothesis was not supported. We did not find a task effect due to large inter-individual differences. Now in this figure, relative stability is on the y-axis. 6 participants lowered their digit force stability. That is, they had lower stability for reaction time tasks with respect to steady tasks, and therefore they had negative values for relative stability. Whereas 5 participants did not lower their digit force stability. However, our second hypothesis was supported, and in this figure, we plot reaction time in milliseconds versus relative stability for 11 participants, and we found a significant linear relation. Individuals with smaller relative stability, that is higher reduction in stability for reaction time tasks with respect to steady tasks, had lower reaction time, thereby supporting the stability maneuverability trade-off. So our results have implications for understanding the loss of dexterity with age, which has a serious negative impact on the quality of life of older adults. Aging leads to slower switching between manual tasks, which arises from system-wide neuromuscular and cognitive changes. This study forms a basis for identifying various motor mechanisms that may also underlie dexterity loss and may lead to novel interventions for arresting the loss. And that's my time. Thank you.
Great, thank you. We now have some questions. So, question for Anna, interesting study. What are the temporal parameters that were used in extracting, what temporal parameters were extracted from the EMG signal?
So I mentioned that we extracted data for a 1-minute level walking trial on a treadmill for each subject. And when we were processing the data, it was high pass filtered at 30 Hertz, and it was low pass filtered at 6 Hertz, and then it was normalized by a maximum value across the walking trial.
And just as a follow-up question, also there was a related question in a different area. Did you consider hormonal status among women in your study?
No, we did not. Actually, that's a very interesting question. I would like to look into that. However, we had a very small sample size. We only had 6 females. So dividing them up into subgroups would have been a little bit difficult to have a significant result.
Right. Yeah. And we have a question for Akash. Do you think that having haptic feedback in a real world environment would have less effect when it's not at the forefront of the user's mind?
Yeah, that's a good question. So our initial experiment was not necessarily parallel to the real world because the person's waiting for something to happen. It's at a random time, but if they're still, it's the primary objective. So in a follow-up experiment, which we recently submitted some work on, we did a dual task experiment where they're doing some visual task. It was a path planning task, a trail making test essentially, where the person would continually play a visual game. And we found that tactile was actually pretty robust underneath those conditions, while visual showed significant differences in terms of it got a lot worse when there was a visual task presented.
I had a question for Mitchell. So I understand that, your results, you didn't get the anticipated results between the rats and humans, which happens. It's a good result. So why do you think that there was that difference, and what are you guys going to try to do in the next step to maybe investigate how you could improve the results that you got?
That's a fantastic question. I'm glad that was asked. So yeah, you're right. This is not what we were expecting. It's kind of the opposite of what we hoped for. And like I said very briefly in the conclusion slide, it could be for any number of reasons. Generally speaking, the mechanism behind vagus nerve stimulation in humans is largely unknown. We know it can treat things such as epilepsy and major depressive disorder, even though we don't fully understand why. So what we're doing kind of in the background is just testing vagus nerve, TVNS on healthy young subjects and just trying to establish reliable biomarkers in the meantime, just to see what physiological variables might TVNS affect. And that can kind of give us some insight as to what we can expect for future studies using TVNS. Hopefully that answers the question a little.
Yeah, no, it does. I appreciate it.
There's another question from Akash related to how you separated the cause for failure. Did all participants start standing about hip width apart? Assuming so, did you think if they started in a more split stance with a foot in front, a foot behind their center mass, they would improve their success rate in the anterior posterior dodging?
Yeah, so we had them stand in a relaxed position, which is essentially hip shoulder length apart. We didn't have them adjust their initial pose to be like in a kind of a sprinter position or something like that. It's shown in previous research that pose indicates your horizontal ground reaction forces. So it's really important to adjust someone's pose in advance. So we're thinking of in the future having some method of influencing someone's pose before a threat is coming, so we can get them in the sort of suboptimal pose to be able to evade that threat as quickly as possible. But yeah, thank you.
Fish, do you have, I'm interested about your future studies and linking this work to your postural controls tasks. Can you tell us a little bit more about kind of that future direction for you based on this work?
Yeah, so we found that stability maneuverability trade-off exists in human prehension, and the kind of analysis we did was across participants. So currently, we are investigating whether this trade-off exists within participants. So yeah, that's the direction that we are heading. And of course, we are going to investigate this in older adults as well.
Yes, so I know, Anna, there were some additional questions. I hope I'm not repeating them. But if it was already asked, but do you plan to investigate potential differences in other synergy characteristics beyond VAF for each number of synergies? I apologize if that was already.
So we actually looked at muscle weights when we were analyzing the data, but we didn't focus on that. We kind of mimicked past literature analysis, and so that's why we decided to compare the VAF between males and females. It certainly would be interesting to continue to look at activation profiles and muscle weights. So definitely something I could look more into.
Great.
As a follow-up, was there also, this is again for Anna, how muscle synergy is defined? This is muscle synergy analysis monitoring co-contraction duration, onset, offset, those kind of things?
So in general, a muscle synergy is a neural strategy that's intended to simplify a motor task. And from my understanding, it's throughout an entire task. However, there are certain subtasks during a stride, for instance, that might require different contributions from different muscles according to your position or the time and point throughout your stride.
Gosh, so where was kind of the initial standing position of your subjects? What was kind of where they at? And do you think that if they started in a more split stance position, would they improve their success rate of anterior posterior dodging? Was that asked?
Yeah.
Oh, sorry.
No worries. This is hard. It's coming fast and furious on the. No worries.
I had to do it at least once.
There we go. That's right. Other questions for the group? Any questions from the speakers to the audience? That's always a fun one.
I guess if there aren't any more, we want to just thank all of our speakers and our participants for coming. I think we had a really nice session. And so again, if you have any more questions, please join us on the Slack channel where we can continue on with everything. But thank you all for a great session and enjoy the rest of the conference.
Thank you.
So Kristin and Jill, thanks very much. Good work there.
Yes, thank you. Thank you for your help and support.
Yay. Anahita, how's it going at